can be prevented. Now, in the fourth block, the first unit deals with HIV, AIDS, and women. Uh, Now, women are by far considered the most, you can say that they are the most vulnerable sections who are prone to transmission of HIV AIDS. Okay, now there are so many reasons we have already discussed. Uh, for example, there is this problem that HIV infection, it is generally seen that HIV infection is transmitted more effectively during sexual intercourse. Okay. Second is there is generally we find that there is a lack of education and usually at times illiteracy among women. And this is a problem in most of the developing countries where the rate of education and literacy among women is rather very low. And that is why women, they do not have the information relating to HIV AIDS. Then there are, of course, these cultural beliefs regarding the role of women in the family and society. So women are generally supposed to be at home looking after the children, and generally they any kind of education or other things, training is not considered very you can say that it is not considered very compulsory for women because more or less there is a general belief that okay, women, they generally have to look after the house, they have to look after the children, so there is no need to educate them. So this means that largely these beliefs, they uh, ensure a continuous low status of women in the society, where they are generally barred from any kind of uh, decision making or informed decision making, and they generally are not having any kind of control over the major decisions of their lives, including the marriage, including childbearing, including control over their own bodies. So all these things are generally not given to women to decide about. Then the fourth is the lack of economic power among women. Now, we have already seen that their lack of education and their lack of training, it ensures that women are generally kept out of the workforce. In many countries, we still see that generally women do not have the right to property or the inheritance to property. There are many laws in several countries of the world where women generally are kept out of the economic areas. There are some countries where you will find that that the women, they generally they do not have the right to their ancestral property or their fraternal property. That means that the property ownership is not with women. Now this ensures that the women are generally having not having any kind of control over the economic resources. Okay. And also their traditional role of family, uh, uh, taking care of the family and the children specifically, also ensures that they do not have the means to earn money because they are not working outside of the house, and this keeps them actually quite disempowered, because until unless you have some economic control, it is generally difficult to have a say in most of the decision making activities, either in the family or even in the community. Now, there is a clear cut link between the powerlessness that women face and the risk to exposure to HIV. Okay. And we see that the social, economic, and the cultural subordination of women, it creates a context. Okay. It creates a backdrop in which women, they generally succumb to the disease. Okay. Now, and this is a thing which is not only for women in India, but also for women in most of the developing countries. Now, the first socio-cultural factor that can be considered is the early sexual intercourse. Now, usually, For in many cultures, initiation to sexual intercourse begins several years earlier for females than for males. Okay, and in many cultures, women are still in their mid-teens when they marry. So this practice of child marriage is prevalent, is rather rampant in several parts of the developing world. And a result of this, women they often they get married to much older men who are sexually they are more experienced. So therefore, chances for women to get HIV infected from a husband who might be indulging in sexual activities outside marriage are definitely higher, as we see. Now, in the developing countries, especially, women they are reported to have acquired the disease heterosexually. Like majority of the women, they generally have been infected. It is generally seen that they have been infected not through their own behavior, but through the behavior of their husband or their partner. So definitely in this case, we can say that it's usually the male behavior, sexual behavior that is more or less responsible for a high rate of HIV transmission among men in most of the developing countries. Okay. The second aspect is the lack of choice. Now, within marriage, we see that women they lack control over their lives or over their husband's life outside the marriage. Okay, extramarital relationships, and intravenous drug abuse or other forms of drug abuse or substance abuse, bisexual behavior on the part of the husband. They are all possible routes for entry of the virus to the woman. And for these women, sexual intercourse is not a question of choice, but it becomes a question of survival. Because most of the time, the wife, they hardly have any say in such matters, like when to have sexual intercourse or how to protect herself, whether she can use a condom, she can ask the husband to use a condom. Okay, how frequent she can have intercourse. If she doesn't want to have an intercourse with the husband, does she have a choice of not having the intercourse? So all these are questions. So basically, women, they do not have any kind of freedom to choose whether to become a mother. Okay, all these things, many a times they are even forced to undergo abortions and other uh, uh, decisions which are actually not taken by them. Another practice which is commonly seen is a poor access to health and education. Now women they are generally generally looked upon mostly as child bearers and child rearers. Okay, and in the sociological division of labor, they have a greater responsibilities towards the children. So obviously, their access to information, education, and mobility becomes rather limited. Okay, because not only because of that, but because of the shortage of financial resources that they have to pay for the use of healthcare facilities. So since they are not earning the money, usually the healthcare support or healthcare facilities for women are generally not given to that extent. It's generally seen that since whoever is the breadwinner in the family, he is more often than not given the kind of healthcare and other facilities that are required. And since women, they are not earning, most of the money is not spent on them or for their health. There is also a kind of a blame game, which goes on, where there is kind of an unfortunate reality. But generally, what happens that when the first case of HIV/AIDS is identified within the family, often the women are blamed for that. Okay, and there is always a fear that her family, because of her perceived past behavior, will abandon her. So she's forced to keep quiet, and she is not in a position to argue her case. So there's always this blame game where the entire blame or the onus of transmission of the disease, it falls to the woman more often than not. So definitely she has to take it all silently. There is always this aspect of isolation and stigma attached to this disease. So it keeps them, you know, uh, it makes them keep their positive status, positive HIV status a secret, because of course we see that they can easily be abandoned by their family, friends, and the community. And that is why more often than not, the women they have to keep total silent about their HIV status. Most of the time, we see that there is always a delay in diagnosis because women are generally not aware of the of this entire concept of HIV. Okay, excuse me, and because of the poor healthcare facilities that are available to them, they are not even diagnosed. Some women, they might discover the HIV positive by accident. Okay, others, after the husband or the child is found to be symptomatic with an HIV related disease, so then they are obviously uh, made to made to undergo the test, and that is how they come to know that okay, they are also positive. Then of course, the dependency of the women on their husbands and for their family for everything, whether it comes about economic dependency, whether it comes about emotional dependency, all that is basically keeping the women more and more in silence about these issues. So even if she may be having certain kind of anger about the maybe the habit of the husband, or maybe the husband is having some extramarital affair, or the husband is addicted to some substances, but still, despite of the anger she might be feeling towards her husband, she has to actually go through the entire thing in a very silent manner. So these are some of the things that keeps the woman having a very low status within the society, and makes them more and more susceptible to the spread of HIV AIDS. Uh, okay, I think I had Ahmed, did you write something? Did you send any message?
Yes, ma'am.
What did you say? I'm sorry, I didn't see it.
Yes. I talked just about our yesterday class. Due to network challenge, I was not able to complete the class. That's why I just wrote something to tell you that the issues that has interrupted my class yesterday.
Okay, okay, no issues, no problem, no problem. Okay, now we will talk about some of the reasons for transmission of this disease in women. So first of all, the first reason, of course, we see is sexual promiscuity. That means that many a times women they have the we find that they have heterosexual promiscuity, and is in most of the cases, it has been found that the male to female transmission is relatively more efficient than female to male transmission. So we will find that most of the times it is generally the HIV passes from the male to the female, which is in most of the cases. And one of the reason is because of the multiple partners. So that is a sexual promiscuity that is being practiced. Second reason are of course, the sexually transmitted diseases. We have already seen that they lead to an increased risk of HIV infection. Now there can be so many sexually transmitted diseases like gonorrhea is there, chlamydia is there, trichomoniasis is there, bacterial vaginosis is there. There are so many other diseases linked to sexually transmitted diseases which are associated with the high risk of HIV transmission. Okay. In many of the times, we find that drug abuse among women is also a major factor for acquiring HIV. Okay, we have already seen not only among males but even females, they may be addicted to drugs, and in case if they are using intravenous syringes to inject drugs inside them, then definitely you will find that there is a greater risk that they they come at a they become great at a greater risk to contract HIV. Okay. Then you also have this the dominance of the male partner, which is seen, which that is the inability of the women to compel her male sexual partner about using certain barrier or some kind of a contraception like a condom, which may substantially decrease the risk of acquiring HIV infections. But this we find that most of the times um, they generally do not practice this. Uh, there are some other things like, you have the role of contraception or intrauterine contraceptive like the IUCDs, which are known as loops, okay? They increase the risk of HIV infection. Most often than not, it is seen. I'm sorry, I got disconnected. Okay. So another thing we see that it is basically the dominance of the spouse and the inability of the woman to actually compel the male partner to use some kind of a barrier or like condoms. That is one of the reason why AIDS is more often than not transmitted to women. Then there are some other things like viral factors. For example, the viral load and the viral characteristics, they also play a certain role in the risk of sexual transmission. So it's generally seen in many, researches that the higher the viral load in the semen and the vaginal secretions, there is a greater risk of transmission. And also, there are certain subtypes of HIV viruses which may be associated with certain types of transmissions. Okay, so again, these viral factors which are responsible. Now, as far as the signs and symptoms is concerned, there are no differences in the manifestation of HIV among men or women. So both they have the same. So we have seen the various things like you have the window period. After that, generally it's a manifestation period where they come from all kinds of illnesses, fever, body pains, rash, headaches, etc. And then they disappear. And then, the HIV infected person, they may have some more other signs and symptoms. So all of these things, these carry on, and this is how the various signs and symptoms they will be seen. Now, after that, we come to the opportunistic infections. Now, the fungal infections of the throat and the esophagus. Okay, that's a common opportunistic infection found in women. Then you may have recurrent bacterial pneumonia, lung infections. They are very common in women. There are other infections like mucocutaneous infections, the herpes infection, then candidiasis, toxoplasmosis, tuberculosis, cryptococcal infections. These are some of the other infections which are also very common when it comes to women. Then there are gynecological infections, okay, like in HIV infections of the reproductive tract, they are referred to as a gynecological infections. And usually the gynecological diseases in HIV infected and not HIV infected women are the same. But certain diseases are more common when it comes to HIV infected women, okay? Now, for example, you find that extensive herpes simplex ulceration that is seen more among the women. Vaginal infections like candidiasis, trichoniasis, bacterial vaginosis, these are more common when it comes to women suffering from HIV, AIDS. Then there are certain kinds of cancers and the precancerous conditions in women, which are commonly occurring among HIV positive females, and they have a greater risk of acquiring cancer, cervical cancer, that's the cervix of the cancer of the cervix. Now, due to the loss of cell-mediated immunity in HIV-infected women, they tend to develop HPV, that is known as the human papilloma virus infections, which are associated with the precancerous lesions. Now, these are very common infection among the HIV positive women. Now, when it comes to treatment, we know that there are basically two regimens of treatments when we talk about HIV treatment. One is a specific treatment for HIV infection, and second is the treatment for opportunistic diseases. So drugs that are given which are specific HIV for HIV treatment, they are known as the antiretroviral drugs. So we have seen earlier that since these are retroviral drugs, that means that they have RNA as their genetic material. Okay, these viruses and drugs are given for specific HIV diseases are called antiretroviral drugs, and several drugs are available nowadays in the market. These drugs may be given in double or triple drug combination. Now, usually these drugs are very expensive and they are beyond the reach of the common man. Most of the time it is seen, although nowadays the government has started started giving these drugs in a more you say reasonable rates. Then, apart from these, there are treatments which are given for opportunistic diseases depending upon the type of disease. For example, the tuberculosis, for candidiasis, and other such diseases, you will have their specific treatment. Now, what is the progression of HIV and the overall survival of infected women in compared to men? Now, generally, it is definitely a less favorable outcome when it comes to HIV infected women. We have already seen that although there is generally we see that there is no data which suggests any kind of difference between the women and men in HIV difference, disease progression and survival. But most of the social factors like availability, not non-availability of medical facilities for women and other things, like the overall culture of silence that is maintained around these women, that makes them more susceptible to having a uh, early death during HIV/AIDS. Now we have already seen how HIV, AIDS, and pregnancy are interrelated, and we have seen that there are a great chances of the virus passing on from the pregnant woman to the unborn child. Largely, it can be passed on through to in three stages or in three ways. First of all, through when the baby is inside the womb of the mother, it can pass on from the mother to the child because the child is taking everything, all the nutrition and everything that is all that is being given provided to the child through the women. So definitely we see that this is the first mode of transmission from mother to child. The second, we have seen that it is during the process of birth. That is, we have seen that especially when there is a normal birth or a vaginal birth, where we have seen that the vaginal area that consists of a higher load of virus, HIV virus. And in such a case, the child can easily pass on the HIV virus from the mother. So the child can easily get that infection from the mother. Excuse me. After that, the third is by through the breastfeeding. We have already seen that breastfeeding is also one route of transmission of HIV from mother to the child. Now, there are certain factors which are associated with the transmission. These have been divided into different categories. Like first is the virological factors, second is the maternal factors, third is the placental factors, fourth is the fetal factors, fifth is the birth canal factors, sixth is the obstetric factors, and finally the newborn factors. Now, viral factors means that a high viral load in pregnant mother could lead to high risk of transmission of HIV to the child. So, in case if the mother who is suffering from HIV, she is carrying a high risk, high viral load, then in her case, the risk of transmission to the child is high. Then there are certain maternal factors also, like sexual intercourse with multiple partners during pregnancy, that can also lead to increased risk of transmission. Uh, there are some placental factors, which means that HIV can be isolated. Any placental disruption could lead to high risk of transmission. Okay, and this can definitely happen. And at times we also see that these viruses can also pass through the placenta. So in that case, we find that in such cases, the virus will go directly to the child. Then factors during delivery, there are things like, the amount of virus in the genital tract, the infant's thin skin, the mucous surface which can absorb the virus during the birth process, the breaking of waters, or any bleeding during the labor or prolonged labor after rupture, all these things can pass on the virus to the child. Now, after that, there are some kind of fetal factors which are seen. For example, there is a differences in the susceptibility of the fetal cells to infection, which may be related to certain genetic factors, like swallowing of infected maternal fluids during the delivery and labor may increase the chances of infection. Then there are certain and of course, but there are, apart from this, there are certain prevention strategies, okay, which we have already seen, which can be taken in everything. For example, less frequent intercourse during the pregnancy, or use of contraception during the pregnancy. That is very much important, okay, to prevent such HIV transmission. Vitamin A supplementation can be given to mother, and along with that, antiretroviral drug therapy that can reduce the viral load in the women. Apart from this, we also see that treatment of sexually transmitted diseases, okay, or preventing the use of drugs or smoking cigarettes, all these can uh, prevent HIV infection among the child. And another very effective strategy is going for a cesarean section or a C-section. That is for an operation instead of a vaginal delivery. This reduces the contraction or the chances of contraction of HIV/AIDS to the child to a very great extent. So we see that this is how the child can be transmitted. Now, we have already seen that among women, there are certain categories of women which are more and more susceptible. Specifically, when we talk about the sex workers, we have talked about sex workers in quite detail in our previous classes. So I will not go too much into detail, but different kinds of sex workers, commercial sex workers, it could be call girls or any other type of women or girls who are involved into commercial sex work. They are generally more susceptible to HIV/AIDS simply because they are because of the multiplicity of the sexual contacts and the high rates of sexually transmitted diseases. Now, another, we can say that in such scenarios, the most important factor for risk reduction would be to spread the awareness of HIV among the commercial sex workers. Okay, so that they know that they are at a high risk of contracting HIV, and that they can protect themselves by reducing the risky behavior. So that is there. Then the use of the social marketing of condom among sexually commercial sex workers, that is one thing that can definitely reduce the chances to a great extent. There is also a need to rehabilitate women who are in the commercial sex work. Okay, because of the fact that till and unless they are brought out of this profession, it is very difficult to protect them from this disease. Then they must also be taught the basic life skill of negotiating. So, how they can negotiate with their clients for using condoms. They must be provided with regular medical checkups so that the STDs can be properly treated. Their HIV status can be found. Okay, and as part of the rehabilitation, they must be encouraged to undergo vocational training so that they can definitely leave that profession and get on some other mode of earning money. Now, up for this, there have been lot many programs which have been started by governments world over for rehabilitating the women and men in the commercial sex trade. And till now, despite it still remains a big challenge, a huge challenge, where this work is still being carried out in so many parts of the world. And because of the high demand for prostituted women and men, we find that it is difficult to actually bring down the cases of HIV/AIDS among sex workers. Then another in problem related to women is the problem of drug addiction. We find that drug addiction is something which is not just happening with men. Many women are also are into drug abuse, and they frequently consume alcohols or other drugs, and this increases the chances of their risky behaviors. For example, not only the developing country, but even in the developed world, intravenous drug usage is a major problem for a large population. And in these countries, a significant proportion of HIV infected women are generally the intravenous drug users. So, drug addiction is also a very common cause of HIV transmission in women. Apart from this, there are certain other issues related to rapes. There could be, some problems related to incest or lesbianism. All these, issues also contribute to the problem of HIV transmission in women and girls. Now, what do you mean by incest? Anybody who can tell me what is meant by incest?
Hello.
Yes, Francis, you want to say?
Incest means a sexual activity between relatives or siblings.
Yes, yes, good. Thank you so much. So, incest means a sexual intercourse between close relatives or between the blood relatives. Okay, so like if a brother or a sister or a parent or their ch children, they are having a sexual relationship, then that is called an incest. In all the societies, incest is a taboo. That means that it is totally prohibited. So, members of the same family or, who are related to each other through blood, they are prohibited from having any kind of a sexual intercourse or any such relationships. But we find that despite of the taboo, in many parts of the world, this is definitely there, and we find so many cases of incest happening. And though it is seen as a socially prohibitive practice, but still we find that it still occurs in many families. And since it is a taboo, it is not supposed to be, it is not, it is prohibited by the society totally. People are generally silent about all these issues, okay? Then we know about lesbianism. What is lesbianism? Anybody can tell me what is lesbianism? Lesbianism means homosexual women, okay? That means women who are sexually interested in other women, okay? They are known as lesbians. So when you talk about, okay, Pilirani, can you just mute yourself? Okay, thank you.
Hello, ma'am.
So, uh, yes, Anas, you want to say something? Yeah. Okay, so this is one important aspect that especially this is basically lesbian for lesbian partners. That is, girls who are interested in having sex with other girls or women. Okay, it's basically the relationship between the person of the same sex. Okay, so when it is between two women, it is known as a lesbian relationship. Now, another problem, most of the time we find that these individuals are, they are found to be having multiple partners. This increases their chance of transmission of AIDS. Another practice which is related to this is the practice of illegal abortions. Many countries, abortion is not legal. Okay, it is illegal, and many a times, girls they become pregnant at an early age or out of wedlock, and in that sense, what happens that they are forced to undergo abortions, mostly in illegal clinics. Now, generally, the way those clinics are run, the health and the hygiene that they follow, the kind of state of instruments that they are using, all this is definitely is something which we do not know. So generally, in such cases, they are not able to seek proper medical facilities from the persons, and that is why we say that the HIV, HIV transmission, it becomes very much possible even in such cases. Okay, so these are the reasons why. These are the some of the factors that increase the risk of women with HIV. Okay. Now, generally, what happens, we find that most of the women who are suffering from um, uh, sexually transmitted diseases, okay, they generally are asymptomatic. They may have discharge from the vagina, which could be larger in quantity. It could be white or yellow in color, could be foul smelling. Generally, they may be having some kind of itching or pain while passing urine. Okay, there may be some kind of ulcers or blisters. They may be with or without pain. So all these infections are generally related to sexually transmitted diseases, but many of the times women are generally asymptomatic, and this makes them more prone to HIV infection. Okay, then how can you treat these things among women? How can you empower women in such conditions? So the first thing is basically spreading education and information among women, which is most important. Women should be uh, given this information whether or not they are literate, and they must be given. So there are now so many non-governmental organizations who are working on in this respect. They are working in this aspect of HIV AIDS and counseling. They are also working in the area of women empowerment, you know, helping them take up the important decisions of their lives. So all these things are something that these women are, that is important to stop the spread of HIV. So first is spreading education and awareness. And the government in many countries, they are doing a lot of work when it comes to spreading awareness and information among women. So nowadays we find that not only these non-governmental organizations, but you also find that this information is readily available to women whenever they visit some hospitals, be it a public hospitals or private hospitals. There are certain tests which have become mandatory. Like in some countries, when a woman becomes pregnant, she is supposed to have a test for HIV, okay, and some other sexually transmitted diseases. So these are the tests that is mandatory, and these are there may be some other tests also which may be mandatory in some other countries. It depends upon from country to country. So these things increases the awareness level among the not only among the women but also among the families about the high risk of contracting HIV. Now, the second thing is, of course, providing them with the opportunity to become economically independent. Till the time women are dependent on their families, on their husbands, it is difficult for them to have a say in any of the decision-making matters. Okay. So, important part is not only to make them economically, to empower them, to provide them with knowledge, but also to give them the opportunity so that they can start earning, they can start um, becoming economically independent, which gives them a greater say in their family. And for this, a rather, a change in the overall social environment that needs to happen. So, till and unless the society is able to see that, ensure that women needs to uh, uh, become more economically independent, they need to have control over economic resources, till the time the society accepts this fact and they change their attitude towards women, the status, the overall status of the women and their condition, it cannot change. Okay, so this is one of the key issue that is important to check the spread of HIV or to prevent the spread of HIV among women. Now, after this, another important category that are at high risk are, of course, children. Now, we've seen that children are at a risk of contracting HIV AIDS because through two things, either uh, due to the mother to child transmission. So, the HIV among children can be transmitted either from mother to child. This may occur in the womb, it can occur during the time of birth or through breastfeeding, we have already seen. The second way it can occur is by whenever a child is sexually abused. Okay, so children who are at a risk of infection, they may include children like the street children, okay, and children in prostitution. There are other some children also like institutionalized children, and because of the high rates of child abuse that may take place in such institutions. So this is how children may get affected. Then children who are suffering from diseases like hemophilia, thalassemia, which require frequent blood transfusion, they are definitely at a greater risk of getting infected with HIV AIDS. Okay, and then there are certain other cultural practices like tattooing, piercing, and all these things, which make the child more susceptible to HIV/AIDS if proper precautions are not taken. Okay. Now, we have already discussed the various modes of transmissions to a great extent, like how it takes place from mother to child. So I need not repeat it. Is there anything which I need to repeat in this?
I hope it was well understood.
Yes, Tripiliro, there is something you want me to explain?
No,
Okay. So we can just go ahead with this, right? Okay. Now, apart from so the various modes of transmission to children we have seen, and we have also seen the children who are at high risk of contracting HIV. Now, what are the basic elements which are included in the programs which is provided to children and families affected by the HIV epidemic? Now, we will discuss some of the components of these programs. First of all, is that such families, including the children, they are provided access to voluntary, confidential, and affordable counseling and testing services. Okay. Now, this is important because till and unless they know their HIV status, they are counseled by the health workers or by the social workers. They will not be able to come out of their high risk behavior. So that is why provision of such services, okay, which has to be confidential, of course, this is very important. So they need to have access to these services. Then disclosure of the child's infection to both parents through counseling, that has to be done so that the parents they know what the child is suffering from, and then they are able to provide the proper um, uh, they are treatment to the child. Then HIV infected people need to be continue in their employment, and this is one of the program which is provided to the families. Why? Because of the economic requirement. Of course, one important thing that we have seen that more often than not, whenever an individual is diagnosed with HIV/AIDS, then the first thing that happens is basically the shunning of that individual by the society at large and by the family. And many a times we see that such individuals are they are harassed, they are made to leave their employment or so whatever they are doing or even their families. So, continuous employment of HIV infected persons, that is very important. Okay. Then treatment of opportunistic infections. Now, what do you mean by treatment of opportunistic infections? That means that infections which occur in individuals, okay, including children, because of their HIV positive status. So the low immunity among these individuals make them susceptible to several disorders. Many a times they are quite rare disorders which are not seen in among individuals, and that is why, in order to prolong the life of the individual, we need to provide treatment to opportunistic infections. Okay. Then planning children's future care. So in case the parents are suffering from HIV/AIDS, the child is not suffering from HIV/AIDS, or whether they are suffering from HIV/AIDS and the child is also suffering from HIV/AIDS, you need to plan the children's future care. So this is something which normally all of the parents they do, okay? All of them they try to plan the future of their child. So planning even in this case is important so that if anything happens to the parents, then of course the child can have proper education. Okay. Then protecting children's inheritance and other legal rights in this respect, that is very important. So we ensure that the children are financially protected and they are having right over the properties. So they are having a control over the property and other resources, economic resources. And of course, this program also includes prevention strategies of preventing infection among the caregivers. So whoever is providing care to the sick in this case, whether it's a family member or whether it is some volunteer or some other healthcare worker, it is important to practice certain precautionary methods that may prevent infections. Okay. Now, there also special assistance is given to children whose parents have died because of HIV/AIDS. Now, we've already seen that children whose parents have died of HIV-related illnesses, they have to actually undergo a lot of trauma, and so These programs also include assisting such children whose parents have died and how they can be taken care of, where they can live after that, what kind of education they can be provided. All these things are certain aspects of the programs for such families. Okay. Now, apart from this, there are certain psychological and emotional um, um, counseling that can be provided to the children in such cases. Okay. Keeping the survivors as integral members of their communities is one such thing which is very important, and this particular element that may be included among the as part of the program. So, whenever whoever is surviving the AIDS or epidemic, or maybe the family of the HIV patient, they need to be considered as an integral part of the community and not just ostracized. Then providing basic material needs, or providing direct assistance to such families is something which is very important. Then, excuse me, looking after the development needs of the children, this is also something which is very important. So the children need to be given education and training on various aspects of life skills education, on sexual health, on HIV, AIDS, and transmission. So we have already seen that many children show sexual behavior at an early age. In many societies, we have now seen that sexual behavior is started taking place among children at a very early age now comparatively. So in this case, we need to, of course, keep the child informed about the various pros and cons of getting into such behavior. Okay. Then there are, of course, some certain special needs of HIV infected children which have to be taken care of. How they can continue to lead normal daily lives instead of their infection, despite of the the special requirements that may be required by the child or by the family. All these things that need to be taken into consideration. Now, one important aspect is to provide what we may call as the assistance to the families with a sick child, and promoting non-discrimination policies and programs for such individuals. So we have to ensure that such children or such families with a child who is suffering from HIV, they are provided with all the support, including financial support as they require. And also, the government need to promote the non-discrimination policies and programs. That is, make sure that the children are provided proper health facilities in the hospitals. The hospitals, they do not, uh, you know, deny the children of the any kind of treatment. Secondly, they are provided with educational facilities, so the schools, they cannot deny treatment to such children. All these things are important aspects of such program. And we have already seen that reaching out to children and adolescents who are vulnerable, especially the street children, children who are suffering from any kind of drug abuse, children who are institutionalized or maybe living in some kind of institutions. It could be an observation home, or it could be a juvenile home, it could be whatever. So if any kind of institution they are living in, what are observation homes? Anybody can tell me what are observations or juvenile homes? Anybody has heard about them? Okay. Basically, juvenile homes or the observation homes, as they are mostly called, these are special institutions which are provided for children in conflict with law. Now, you do not follow the same kind of law when you talk about children who have committed certain crime. Okay, children are not considered criminal like in the normal sense, as in you cannot jail a child who is under the age of 18 in a normal prison for the same reason that the United Nations Convention on Rights of the Child prohibits the uh, such criminal treatment of children, as in they cannot be considered as criminals because they are supposed to be considered as individuals who do not have any kind of knowledge about what is good or bad for them. So generally, what happens, children, they do not have the knowledge. Okay, they cannot tell you what is right, what is wrong. And most of the times we find that they generally get into such acts of violence or maybe acts of theft because of their own particular need. Or maybe sometimes they may be, um, uh, you know, um, they may be pushed into these criminal activities by the adults. So we say that generally children, they are not capable of committing a crime. And this is the reason why even if a child has committed an act which is considered illegal by the court of law of that particular country, children are still made to go into these homes which are known as the juvenile homes or observation homes, which are different from jail. So they are not given the same criminal treatment as given to the adults, and they are kept into these juvenile homes. They are given training in order to overcome this habit of breaking the law, to reform themselves. They are given training so that they can be rehabilitated, and once they come of age, that is once they become 18 years of age, then they are generally asked to go back to their families or wherever they were, or whoever their caregiver is. So these are what juvenile homes are. Okay, so juvenile homes or observation homes, they are special institutions for children who have committed some certain kind of uh, who have shown certain kind of criminal behavior. Okay, so this is exactly one kind of institution where children are kept. Now, one another important aspect when we talk about is the children who are living on the street. Now, who are the children who are living on the street? Anybody? Who are the children who are living on the street?
They not street kids.
Okay, like what street kids?
Street kids are children that are homeless. The only thing they do to survive is to
Okay,
ask people
I think.
for everything
Okay,
that
okay. You must have seen street children. I think and they are there in all the countries, right? There are children who are living on the street. You find them there generally either on the street living there, whatever, doing some small some odd work, and or maybe selling something. They're generally living on the street. They generally do not have the family, or even if they have a family, they are spending most of their time on the street. So these are known as the street children. Now, they are very much susceptible to HIV infection. We've already seen because of the drug addiction that most of the street children are into. They are also very much prone to different kinds of abuses, including sexual abuse, okay, which may happen because they are most unprotected lot. Okay, like they are on the street, they are there, any kind of they are susceptible to any kind of crime being done on them by an adult or some any other individual, and that is why street children are very susceptible to HIV AIDS because of these things. Now, there are uh, certain safeguards that the government they have to take in order to um, protect the children from HIV/AIDS, and this has been brought about by the United Nations Convention on the Rights of the Child, which lays down the detailed rights of the children as well as the children living with HIV AIDS. So they just don't do not talk about children with AIDS, but it is a document which talks about the children in general and also about children in difficult situations, including HIV AIDS. So first of all, it states that basically the state should include HIV AIDS as a disability, okay? And to strengthen and protect the people living with HIV AIDS and protect them against any kind of a discrimination, okay? Second, the state needs to profile the children who are suffering from HIV AIDS, and special measures need to be taken by the government to prevent and minimize the impact of HIV AIDS, which is caused by certain criminal activities like, human trafficking. It could be because of forced prostitution, sexual exploitation of children, okay, sexual abuse, use of injecting drugs, and harmful traditional practices, which may be making the children more susceptible to HIV AIDS. Then children's their right to life, their right to survival and development should be guaranteed. Their right to confidentiality and privacy in regard to their HIV status should also be recognized. They should also have access to social benefits, including any kind of social security and social insurance. Children should also have access to HIV/AIDS prevention, education, and information, and to the means of prevention. So, of course, as we've already discussed, that these educational measures, these awareness building measures need to be given to children at an early age because of these aspects. Then children should have access to healthcare services and programs. Okay. And any kind of barrier should be removed, which makes them especially vulnerable. Okay. Then they need to enjoy adequate standards of living. So these are some of the basic aspects that need to be included in the program for protecting the children as part of the United Nations Convention on Rights of the Child. Now, another important aspect in this regard is HIV and cases of substance abuse. Now, we know that there is a very strong relation between HIV/AIDS infection and substance abuse. How? Because there are various reasons. First of all, there is this entire thing that generally individuals who are addicted to certain substances, you know, they may have now, first of all, actually, before going into this, first of all, let us discuss what does a person, when does a person become an addict? So, if can anybody tell me who an addict is, a drug addict or a substance addict, who an addict is?
Uh, an addict person is the person that can not live without doing it. If he or she uses drugs and substances, he cannot survive if she or he spend a day without using it, which
Okay,
means,
good,
yeah.
Francis. Okay, Francis, you
Yeah,
want to say?
yeah, I wanted to say that mostly the substance that people have used beyond its intended use, uh, for example, substances that are meant maybe to treat other ailments. For example, I would say pethidine. Alcohol can also be an addictive, but people can take alcohol. It's normal to take alcohol, but if someone has taken those substances beyond its agreeable limits, it's when we say this person is addicted, and I think that's the basic of addiction.
Okay, Francis, thank you so much. That is quite correct. See, generally there are four factors which make a person addict to drugs. Okay, we say that the person has become an addict. First is that he has a compulsive desire to continue to take the drug. So he cannot just not take the drug. He needs to take the drug because it is very important to sustain himself or his, body functions. He is not able to hold this desire of taking the drug, then a person is willing to get it by any method. So whether you have the means to buy the drug or you do not have the means to buy the drug, you will do anything to any extent, go to any extent to buy that drug, okay? So that is why we say that that person has become an addict. The third is that he or she increases the dose. Francis, can you just mute yourself, please? Thank you. The person increases the dose in such a way that he or she becomes psychologically and physically dependent on its effect. So, until unless he or she takes that particular level or dose of that substance, he or she is not able to carry out normal body functions, okay? Or may feel very weak generally or lethargic. So, they become psychologically and physically dependent on its effect. And the last phase is that if a person um, uh, suffers from, if the physical or the mental faculties of the person are both affected due to taking the drug, then the person may be termed as an addict. Okay, so you can easily spot a person if he or she is taking a drug. Most of all, they are under the influence of that drug. So the way that they are behaving, the way they are talking to you, the way they are, their gestures, everything, it makes it clear whether the person is an addict or not. So these are the four things that make a person addict. Now, what are the health hazards of addiction? Okay, I want you people to tell me what are the health hazard of addiction. Anybody? Yes, Francis?
As I put it earlier to say, addicts usually use drugs that practically they are intended for a good use. So any overdose or any addiction or any
Okay.
overuse will deteriorate
Uh-huh.
some organs at certain parts. It will alter the mental function. It will alter the physical
Okay.
function. Yes.
Okay, there are see so many psychological and physical functions that drugs can cause, starting from cold sweat to muscular spasms to insomnia or sleeplessness to a kind of, nervousness to, even to as something as extreme as paranoid psychosis. Okay, there are different types of drugs which may be given. We will discuss about it, but there are different kinds of drugs, and depending upon the type of drug, they can have different physical and mental um um, hazards. Then, overdose of certain drugs can even lead to death of an individual. We have come across so many persons we see in the news that many actor or actresses or so many other persons they suffer from they die due to a drug abuse. Have you heard about know anybody who has died of
Yes,
a overdose, drug overdose? So many individuals have died. Even they say that Michael Jackson also died of drug overdose, right? Just check, correct me if I'm wrong. Generally, they say that there are so many cases or instances where the individuals they succumb to the drug overdose. If they take that particular drug in higher doses, then it can even lead to the death of an individual. And most of the damages that are caused by these drugs are irreversible. Okay. They are, and even if you stop the drugs, if you try to stop consuming these drugs, then you will find that these individuals will suffer from very horrible and painful withdrawal symptoms. Okay, so this makes them even difficult to overcome this addiction of taking drugs. Then there are economic crises which are related to drug addiction. We know that generally they will drain one's financial resources. And maybe at times there have been so many cases where that person will take away the money or not spend this income on the families and spend it all on buying the drugs. Okay, there have been so many cases where they might even actually, develop a habit of uh, maybe even resorting to crimes like theft in order to provide for the money for the drugs. So economic crisis and criminal activities are again two things. So these are some of the various side effects of substance abuse or drug abuse. Now, how are the drug abusers vulnerable? Basically, first of all, the drug abusers are vulnerable because many of them take up intrauterine drug use. Okay, they make intrauterine drug use. That means that they generally inject the drugs into the body through use of intravenous injections, and this leads to the increased chances of HIV positive. Second, they may indulge in greater sexual activities, okay, or with multi-partner activities, which may make them all the more, not only all the more susceptible to HIV transmission, but also as very potent, uh, you know, reason for HIV. They might even transmit that into their partner or other members. So this is how they are vulnerable to um, HIV infection. Now, what happened? There are again different kinds of drugs, which we may say when we talk about drugs. It is important that we first understand exactly what are the different kinds of drugs that are involved. So, see, there are generally three types of drugs which have been classified. Uh, there could be gateway drugs. Gateway drugs are basically the drugs that initiate a person into the world of drugs. For example, cigarettes, alcohols, cigars, tobacco, chewing tobacco in various forms. These are called gateway drugs. They introduce the person or initiate the person into the world of drugs. The second are the legal drugs. Now, legal drugs are those drugs that are allowed to be sold in the market. Okay, they are generally sold by the government or the government approved seller or distributor, and it is sold with the knowledge of the government that they have various methods of regulating the distribution of these drugs through licensing, through imposing taxes, restricting the timings of sale, and taking legal action on those who do not follow the regulations. Okay, for example, in many countries, alcohols and other narcotics, they are controlled in this way. So there are various restrictions that have been given by the government on the sale of such drugs. Then there are certain illegal or hardcore drugs, which are those substances which are prohibited by the law. For example, cocaine, then you have magic mushrooms, opium, brown sugar, these cannabis, all these substances, it comes under the illegal category or hardcore drugs category, where any kind of sale or distribution of these drugs are punishable by the law. And different countries have different laws relating to the control of the sale and distribution of drugs, as well as the punishment which is given to illegal drugs. In many countries, it may be life imprisonment. In some countries, it may be, maybe death penalty. So it depends from country to country, the different penalty that they have on people who are actually selling or distributing these illegal drugs. Now, then there is a classification of drugs which is based on their pharmacological actions, like what kind of action they have on the body. So in this, we find that there are basically four types of drugs. First are what is known as the depressants. Depressants are the drugs which tend to depress the activity of the central nervous system. So what happens is once you take these drugs, you will become calmer. Like this is exactly what we generally see in the sleeping pills. Okay, that makes a person calm down. Okay, that calms down the brain or the central nervous system. Sorry. Some examples include barbiturates. Okay, then it could be methaqualone. Okay, benzodiazepine. These are all tranquilizers or other tranquilizers like Valium. These are what? These are all depressants that they depress the activities of the central nervous system. Then there are some other drugs which are known as the stimulants. Stimulants are the drugs which tend to stimulate the activities of the central nervous system. Okay, so they enhance the wakefulness, they stimulate your mood. Okay, and even at times they may even forget make a person forget any kind of fatigue. Okay, so many of them, many of the drugs like amphetamines, they are used to keep, they come as stimulants. Okay, then there is another category which are known as the hallucinogens. Hallucinogens are drugs which distort the perception of the uh, environment. Okay, so the users, okay, the people who are using hallucinogens, they may feel a bit confused and disoriented, like whatever where they are, they just don't know where they are, what time of the day it is. They, they may have other such visions of things or of people which are actually not there. For example, lysergic acid diethylamine, which is known as the LSD. LSD is a very popular hallucinogen, and this interferes with the higher incidence of interferes with the perception of an individual. Okay, so hallucinogens are basically induce confusion and disorientation. Then there is another thing which is known as a narcotics. Narcotics are used to suppress pain, but they are abused to alter moods. Okay, generally, you have narcotics coming from three plus substances from three plants, namely the poppy, the coca, and the cannabis. Okay, so these three plants are responsible for producing substances from which the narcotics are derived. Excuse me. Apart from this, there may be quite many synthetic drugs which are used, and these are used in various kinds of health problems. They generally do away with the pain in the body or any part of the body and all these things. So they are generally used for medicinal purposes, but many a times they may be used for some abuse. Now you know that there are so many people who are actually addicted to painkillers, right? Do you know that there are people who are addicted to painkillers? Okay, so painkillers, that is also a very serious addiction which is seen, and that is quite dangerous because it affects your overall health, including it damages the kidney and liver and other parts of the bodies, okay, leading to multiple organ failure if it is taken in higher doses. So that is why painkillers and other such things like even a sleeping pill, these are always given upon prescription. They are never taken or sold without prescription of the doctors, okay, for these reasons. Now, there are certain different methods by which drugs can be taken. There are certain drugs which are taken orally, okay, like you take them as pills, or you drink them, or you just take them orally, or smoke them. Then there are certain injections which are injected, okay, some which are snorted, like you take them through the nose, okay, you have to like sniff them, snort them. Okay, so these are the various ways of taking these drugs. And out of these, the most harmful way is definitely, needless to say, is the taking drugs through injections or intrauterine syringes. Okay. Now we have seen that usually what happens many of the times, in order to get the drug, these people may get into some activities like prostitution. Okay, they may become professional blood donors, and some other things in order to get money to buy these substances. So this makes them at a very high risk of contracting HIV, and not only that, they also are very potent, individuals for spreading HIV. And that is why we have seen in the earlier chapters that many countries, they have banned the use of professional blood donors. Okay, like especially in India, there may be some other countries which have come up with this concept, but many countries, they have come up with the concept of banning the use of professional blood donors, where they do not accept a person who is donate, who is giving the blood in a professional manner. Like earlier, they used to have people who used to sell their blood for some money. Okay, but now this has been totally prohibited by the governments. Okay, excuse me. Now, what are the things that can be done in order to stop the spread of HIV transmission due to the blood, due to the drug addiction? Okay. The first of all, the most important thing is motivating the youth as well as other individuals for prevention of, you know, drug addiction. So if they can be motivated to keep off drugs, if there are awareness programs, if there are such programs which are uh, run by the media and of basically of how you can motivate the youth of giving up drugs or not getting into the practice in the first sense, or the what are the harmful implications of taking drugs. All these things can go a long way in preventing the not only drug addiction but also the spread of HIV AIDS through drug addiction. Then second is enacting and implementing laws which punish or deter a person from becoming an addict. So strict laws should be there, okay, and any buying or selling of such a prohibited drugs need to be considered as a serious offense, and the authorities need to be strictly vigilant about the implementation of such laws, okay, so that this can be prevented to a great extent. Then proper healthcare needs to be provided to substance abusers, not only healthcare facilities, but also de-addiction centers must be open in various communities or various centers. They must be there which keep them, which help them to overcome the drug addiction. And usually they have a various multi-pronged approach where they are provided medicines, they are provided some other exercises, or even some things like meditations and other such things, habits or exercises which may help them to overcome this habit of drug addiction. And counseling, of course, is provided to such addicts as well as their family of how they can overcome this habit. So, this is all about the drug addiction and the spread and prevalence of HIV/AIDS. Now, after this, we come to the concept of sexually transmitted diseases and their management. Now, we have known earlier, we have studied earlier that there is a very close connection between the sexually transmitted disease and HIV infection. And those individuals that are suffering from sexually transmitted diseases, they are more prone to HIV infections. Excuse me. Okay. So, generally, when do you know that a person becomes infected with HIV or with STDs? Generally, where a person may become infected with STD when he or she has done some kind of vaginal sexual intercourse or anal sexual intercourse or oral sex with an infected person. So and if an individual does any of the three kind of activities, sexual activities with another infected person, then there are very strong chances of he or she getting into sexually transmitted diseases. Now, there is generally a very high incidence of prevalence of STDs among the populations, various populations worldwide, and even in India, it is as high as 5%. The rate of such incidence of sexually transmitted diseases in India is as high as 5%. It is different for different countries, so you have to find out exactly what the statistics are in your particular country. Now, there is some kind of, there are a lot of misconceptions which are related to these sexually transmitted diseases, among the population about regarding how it is transmitted. Okay, for example, lack of genital hygiene or visiting dirty toilets, using unclean underclothing, they may cause STDs. Excessive heat can cause eating spicy food or drinking alcohol may lead to STDs. So these are generally, generally the general misconceptions regarding the transmission. Also, regarding the prevention, also there are certain kind of uh, uh, misconceptions, and also regarding their treatment. So there are basically a lot of misconceptions related to these STDs. But I think it is important to understand that most of these are generally not true, and they have to be seen from a totally different context altogether. Now, what happened that why do you think sexually transmitted diseases and the treatment are important? It is important for so many reasons, but first is that it affects millions of men and women and children every year across the world. Most of these sexually transmitted diseases, they show early symptoms, but then they disappear without any treatment. But the germs of this disease, it continue to remain in the body. And anyone with a sexually transmitted disease may look healthy, but he or she can still keep infecting others. Okay, so this is there. Then the sexually transmitted diseases is a recurrent disease. Like it can occur again and again in the same individual because the human body cannot build immunity against them, and there is no vaccination for them. Some of the STDs, they may produce ulcers on the genitalia. Okay, these are generally they become very high risk of HIV transmission. So individuals who suffer from these ulcers, they become they come at a high risk of HIV transmission. Now, these can also cause very profound problems, especially in women. Okay, it may spread to the uterus, it may spread to the fallopian tubes, and the pelvic inflammatory disease may be caused because of this, which can be quite painful. At times, the tubes also may get blocked, and women may not be able to produce children. Okay, so it may cause sterility and in women. In other instances, it may also known as what is known as a tubal pregnancy, which may be sometimes fatal. Now, a tubal pregnancy is where the the fallopian tubes, generally what happens is if when you study about the reproduction part, then we find that uh, after the sperms enter, they generally fertilize the ovum in the fallopian tubes, and after that it goes what is known as the ovum, the fertilized ovum. It goes to the uterus, and that is where it sticks itself in order to develop into a full-term baby. But usually, what happens for some reason or the other, and especially among women who are suffering from these sexually transmitted diseases, this does not happen. Okay, so the embryo which is formed, it does not move to the uterus. There may be certain blockages, and or because of sexually transmitted diseases, some blockages may occur, and as a result of this, this may lead to tubal pregnancy, which may lead to rupture of the fallopian tube and ultimately death of the woman. So it may be quite fatal if it is not uh, uh, diagnosed early. Now, many times STDs may also cause cervical cancer among women. Okay, and all these may even lead to other forms of cancer as well. Now, then there are some other untreated complications which may be caused, it may cause liver problems, it may cause heart problems or brain problems. And so basically all these, that is why the STDs, they are so important to understand, and also to understand that a full course or a treatment needs to be taken in terms of STD, and even if when the person becomes unsymptomatic, does not mean that the disease is gone. They need to get full treatment so that they can uh, protect themselves from the long-term consequences of the disease. Now, now how STDs are important in relation to HIV/AIDS. So we've already seen that STDs and HIV, they are both associated with the same risky behavior of having sexual intercourse with multiple partners. Second, the presence of sexually transmitted disease actually facilitate the acquisition and transmission of HIV infection. Okay. Then these diseases also they now these disease they have a break in the mucosa. So they break the mucosa, and that means that and there is a rich collection of the CD4 cells on the broken mucosa. Now, the virus can easily enter the broken mucosa and infect the CD4 cells, and presence of ulcerative disease increases the risk of acquiring HIV infection tenfold because of the break in the mucosa. Then there are other such diseases like gonorrhea or chlamydia, which it also increase the risk of HIV. So an early diagnosis is very much important in order to reduce the HIV transmission. Apart from this, there are certain treatments which are there available for STDs. So, depending upon the type of STDs a person is suffering from, there are various treatments which are available in the market. Governments world over, they are trying to provide cheap or subsidized treatment or healthcare facilities to such patients who are at high risk or who are suffering from sexually transmitted diseases. And since their treatment is available, it is advisable that persons who are suffering from these diseases, venereal diseases, they need to go for a full treatment of these diseases so that they are able to uh, prevent the spread of HIV, AIDS, as well as some other diseases that may occur because of, or other complications that may occur because of these venereal diseases. Okay? Any questions related to this? Any questions related to sexually transmitted diseases? So I can assume we are good. We can go to the next topic, which is actually the HIV, AIDS, and the sexual minorities. Now, what do you mean by sexual minorities? Anybody? Who are the sexual minorities? See, sexual minorities are groups whose sexual identity, their sexual orientation, or sexual practices, they differ from the majority of the surrounding society. So if the surrounding society has majority of heterosexuals, then we will say that the homosexuals, including the bisexuals or the gay or the lesbians, they are the sexual minorities in that particular community. Okay? Now, usually what happens that the male-female dichotomy in heteronormative societies that has created certain serious problems in the life of sexual minorities. Okay? That means to say that most of the societies they only allow the heterosexual relationships, that is the sexual relationship between a man and a woman, and that is seen more in terms of the reproductive importance which is assigned to the heterosexual relationship. Okay, but in many times we see that there are individuals who do not have this kind of attraction for the opposite sex, but they have an attraction for the same sex. So there may be a girl may be sexually more aroused by a female, and a boy may be sexually aroused more by a male. So there could be some kind of a romantic attraction, a sexual attraction, or sexual behavior between members of the same sex. Now, this sexual orientation is known as homosexuality. That is, it's an enduring pattern of emotional, romantic, and or sexual attraction to people of the same sex. Okay, so this is generally considered to be in what we know as minority. Why? Because generally such corrections or these relationships are not accepted or allowed by the society, general society. Okay. Now, generally, what happens in heterosexual societies, whenever there is this, we don't know exactly how this sexual orientation is caused among such individuals. Why? But generally, it is believed that it may be caused because of some complex interplay of genetic, hormonal, and environmental influences. So it is not considered as choice by the scientists nowadays. Though they said that if any individual is homosexual, it could be an interplay of certain genetic, hormonal, and some environmental influences on the individual. Now, generally, the scientists they favor some more biologically based theories for homosexuality, which point to certain genetic factors, early uterine environment, and inclusion of genetic as well as the social factors in becoming a homosexual. So basically, there are a lot of the research that is going on, and most of these point out to some more biological factors that are responsible for homosexuality among individuals. Now, one thing that you must understand that basically we use this term homosexual for both. We use this term homosexual for men who are having sex with men, okay, so that they are known as gay. And then we also use this term for females who are having sex with females, and we term them lesbian, okay. And though at times gay is sometimes also referred to both homosexual males and females. So that is also there. But we generally use this term specifically as a more common term for such individuals. Now, apart from this, there are some other minorities which like the transsexuals or the transgenders. Now, what happens that one must understand that this is not something which is of a recent phenomena. This existence of transsexuals and transgenders or eunuchs, it has been there since ancient times, and you come across so many societies where they played a very important role. For example, if you know that in many ancient societies, the women of the royal families, okay, they used to have the gay men or the transgenders as the protectors, okay. So they used to have the transgenders because they never had any kind of sexual arousal for the women. So many of the royal families they used to have these transgenders to protect the females in the family, in the royal family. Now, what happened? There are certain generally transsexuals are basically persons who experience a gender identity that is inconsistent with culturally associated sex, like male or female. They do not associate themselves with any of the two sex. Okay. And many a times they may either they are born with that or they may acquire this through some medical assistance, including the hormone replacement therapy and some other sex reassignment therapies. So generally, sometimes these therapies they help them to align their body with their identified sex or a gender. Now, transsexuals is generally considered as a subset of transgender, but some transsexual people they reject the label of transgender. Now, transgenders are sometimes, as I've already said, that sometimes they are called as transsexual if they desire medical assistance for transition from one sex to another. So transgender, we see it's kind of an umbrella term. Okay. Apart from this, it includes other persons whose gender identity is the opposite of their assigned sex. and it may include people who are not exclusively masculine or feminine. Okay, so these are these people who are like gender queer, which means they could be bigender, pangender, gender fluid, or agender. Like they do not identify as any. They may be having a gender fluids. Like sometimes they feel masculine, sometimes they feel feminine. There are so many other kind of gender identities who have been termed as the gender queer identities. So we have what is termed as the LGBTQ plus communities. Okay, so the United Nations has termed all these under the umbrella of LGBTQ plus communities. Okay, that is lesbian, that is L for lesbian, G for gay, B for bisexuals, T for transgenders, Q for queer. Okay, now up, now these sexual minorities, they have been given certain rights in many countries. Like we have already seen that nowadays many countries, they have uh, decriminalized activities, homosexual activities. They have started ascertaining the right of the sexual minorities, and giving them a more open and a more respectable position in the society. Like there are so many societies, and even in the United Nations, they clearly spell out that even these populations, they have the right to certain things, like they have the right to privacy in the context of their sexual orientation. Okay, they have the right to basically all kinds of freedoms that a normal individual may enjoy in that particular society. Okay, so they have all the rights, except that in the present context, many countries have still not identified the homosexual marriages as legal and adoption as legal, because of the fact that the traditional approach that the societies have, it prohibits such kind of marriages from taking place. So many societies, including India, they still do not have a legal right of the homosexuals to get married or to stay in a matrimonial relationship with each other or even adopt children. While in many countries today, we find that they have been given this right of settling down with each other, of even adopting children, okay, or producing a children of their own through various medical procedures. So that is now allowed in many countries, but still there are countries, by and large, there remain countries where, because of the traditional outlook, these kind of relationships have still not been legalized, and in some countries they are even criminalized. Okay, like we have seen, that depends from country to country. In India, it is not a crime to commit a homosexual act, but any kind of matrimonial relationship between homosexual individual is prohibited. Okay, so you cannot uh, as of now, this is how the system is in India. Now, that will depend from country to country and from region to region. Like for example, in United States itself, not all the states have given the right to gay marriage. Okay, they have not homosexual marriages. They have not made homosexual marriages as legal. So that depends again from country to country and from region to region. Okay. Now, how can you, one important aspect is that government needs to consider is to provide physical, mental, and social well-being of sexual minorities. Okay. Now, since these are also the minorities high at these are also the population which are at high risk of developing STDs and AIDS, and therefore uh, a lot of education and awareness generation among such population, providing them with psychosocial, counseling, and providing them with the healthcare facilities. Okay, all these things are very necessary when we talk about these relationships, and many times we find that these minorities are also at risk of developing certain emotional disorders because of the stigma and the discrimination that they have to face in the society. So it becomes very imperative that these uh, that these communities, they need to be provided with the counseling that they require, and also proper care needs to be taken to remove the stigma and the discrimination that they have to face day in day out from the larger population. Okay, many times you see that they are generally physically, verbally, and sexually abused, okay, which may cause a lot of disturbances and disorders. So these, many a times they are also, you can say that they are totally boycotted by their communities or ostracized by their communities and families. Okay, they are forced into prostitution and some other activities. So this uh, is important. So it is important that because of the stigma, exclusion, and the discrimination that is attached to this to the sexual minorities, that they be provided with the health facilities, with psychosocial counseling facilities from time to time, and also awareness programs need to be run not only for the sexual minorities but also for the larger population, of accepting their existence, accepting their inherent right as an individual, okay, and basically uh, preventing any kind of stigmatization on their part. So these are some of the things that we have to understand of how the sexual minorities, they are more at risk of HIV and STDs, and what we can do in order to uh, improve their standards, improve their socioeconomic conditions, and improve their chances at life free from HIV/AIDS. So this brings us to the end of the fourth block. Now, as I said yesterday, I wanted to keep the last part of the uh, this more interactive, and I needed, if anybody has any kind of difficulties with regard to all the four blocks, then they may ask. Since today is a last session, I would really welcome questions and queries from your side. So if you have any kind of questions related to the whatever we have covered till now on public health and HIV, then you're free to do that. So any questions from anybody, any queries or any part that they have not been able to understand?
Hello, ma'am.
Yes, Anas.
I need more explanation on equal protection and discrimination.
On what?
Equal protection and
Okay, okay.
discrimination.
Equal protection and discrimination.
Yeah, ma'am.
You want to understand the concept of equal protection and discrimination?
Yeah,
Like
ma'am.
in context of what? In context of persons with HIV, AIDS, it has to be in some context, right?
Okay, in contents of the HIV, ma'am.
Okay. So, equal protection and discrimination. Now, equal protection means that all the individuals, every individual, irrespective of his or her HIV status, they have the right to be equally protected by law from any kind of injustice, from any kind of prejudice, from any kind of violence and abuse. So, just on the pretext that an individual is suffering from HIV/AIDS, we cannot subject the person to any kind of, uh, you know, unfair treatment or unequal treatment. Like many a times we find that the HIV positive individuals, they are denied entry into hospitals. They are denied, healthcare facilities by hospitals. Many a times, whenever an individual is uh, if found to be HIV positive, then they may be denied their employment, or maybe they are totally just, you can say that they are just kicked out of their services or employment opportunities. And people, they generally start they're treating them badly. So this is something which must not be there. So irrespective of the HIV status of any individual, we need to protect them and we need to give them equal treatment, give them equal opportunities as any other person who is living a normal life would do. Okay, so this is what equal protection is. And discrimination means, yeah.
Okay, continue, continue, ma.
Yeah, and discrimination means basically not providing them equal opportunities or infringing upon the right of the individuals. So you can discriminate on the basis of age. A person may be discriminated on the basis of sex. A person may be discriminated on the basis of HIV status or even gender, sexual orientation. So all these are the various bases on which a person may be discriminated. Okay, so their rights may be violated, they may be given unequal treatment with regard to education facilities, with regard to employment opportunities, or so many other things. Basically, with regard to living a normal life. So this is what exactly equal treatment versus discrimination is all about. I hope I have made your question clear, Anas.
Yes, ma. Thank you for the explanation, ma. Thank you very much.
Okay, thank you, Anas, for your participation. Okay, so now we have Candiro. Candiro, you wanted to ask something?
Yes, madam. I just want to ask two questions, but the following, the second question will come after you answer me the first one. If you can remember very well for the first time when we were learning about how HIV AIDS started, and we have heard
Yeah,
that some transmission between a chimpanzee and a human being. So I want to know that human being, was it a woman or a man?
that is still not clear. Like, I am not in a position to say exactly how it spread or who was the. See, the first person who was actually officially affected with HIV was a gay man. Okay, it was a man who was a homosexual. So this is what we all know. And as you know that usually generally they do not have this, they do not open such cases. But generally what is known is in 1981 when the first case of HIV was uh, found, it was found to be in a man who was actually homosexual, who was a homosexual man. Okay, like he was having multiple sexual partners, but usually they used to be men. So this is how the first case of HIV was the uh, and how the doctors found was he was suffering from very rare kind of a pneumonia, which is generally not seen usually among normal individuals. They are seen more in individuals who have undergone some kind of a chemotherapy or some cancer treatment. So that is how they found out that the immunity of that individual was very much lowered because of the existence of certain virus, and this is how we traced the first case of HIV AIDS in US. Although after subsequent studies, when they were found out, it was found that actually the existence of human immunodeficiency virus in human population may date back as early as to the First World War and the Second World War. But still, there are no clear studies on that. Okay. So the only thing we know for sure that it was found that the first case of AIDS was found in a patient who was a homosexual man in US. Okay? Yeah, Davis.
Uh, all right, that means that rumors that way I heard that this HIV is was there was some contact between a human and a chimpanzee. Is it false rumors? Not so.
I mean, are you talking about chimpanzees?
A monkey.
See, a
Madam.
monkey. Okay, chimpanzee, a monkey. See, basically, this is just a theory which suggests that it could have been because of transmission of a virus from the animal population to the human population, but it is not very clear. It is not proved. Okay, it is like only just a theory. So there is no clear study whether it can be transmitted from a chimpanzee or a monkey to the human population. But since many of the viruses they have been studied, they have a history of transmission from animal to humans, we say that it could be a likely possibility. But for example, the SARS virus or even the recent coronavirus, it is said to spread from bats, okay, from bats to humans. That is how it takes a jump from the animal body to the human body. But again, it is not very clear. There are not enough studies which can prove this theory, so it is just a theory which is there. So you need not worry about it. Are you anyways working in close association with some agency who's working with monkeys? Okay, Davis, you wanted to ask something?
Yes, madam. I wanted just a clarification. Firstly,
Yeah.
you tried to break up this word LGBTQ, but I didn't clearly understand the last letter,
Okay.
the Q part.
L LGBTQ. LGBTQ are basically, it is an umbrella term which is used to denote a number of individuals belonging to different communities who are having a particular sexual orientation. For example, L, the word L in LGBTQ refers to the concept of lesbian. Lesbian means a woman who is sexually oriented towards sex, having sex with another woman. Okay? So that is basically a homosexual woman who prefers to have sex with a woman. That's a lesbian. Okay, LGG stands for gay. Gay usually means a homosexual man, although in many societies, gay may be used for a homosexual man as well as a woman. But generally, a gay